So for my example, I decided to do a virus that has similar that acts like the coronavirus, more or less. So with my example, we can see that even if more than half of the population decide to stay at home or self-isolate, still a lot of people get affected by this virus. And as we can see, there are a lot of people who get sick.
In this model, we have a huge amount of people, which is 200, half of 50% of infection chance, and a 40% of recovery. As we can see, 40% is not a big amount, but when all starts, few people get infected and try to contaminate the other ones, but people tend to recover more easily since there is only a 50% of infection, and that means that people do recover more easily than if the infection chance was bigger. And as we can see, more and more people tend to recover and get well, so the infection chance isn't high enough to get all of the 200 people sick.
I experimented a disease spread with 400 people who all had 50% of chance of infection and 50% of recovery chance. The recovery process is about 120 hours, and the average insolation tendency is about 10%. However, I programmed the simulation to have 20% of hospital-going tendency. There aren't neither initial ambulances nor risk of inoculation. As we can see in the results graphics, from the people who got infected, there is 120% of recovered people and 119% of infected people. On the other hand, there is 120% who weren't infected from the beginning of the experiment. In 120 hours, everyone was safe.